Hey guys, in this video we're going to talk about the nutritional deficiencies from gastric bypass. Now when they do a gastric bypass, they bring your stomach lining or surface area down to 10% of what it should be. So thereby automatically putting you in a situation where you're not absorbing as many nutrients, not just from the stomach, but from the small intestine. So we're going to go through and just talk about that. But they talk about gastric bypass is a healthy thing because they're going to go off the calorie reduction, but unfortunately it comes with a package. Number one, your calcium levels are going to usually be low, and the problem with that is that if you don't have enough acid in your stomach because you're only operating off of a smaller pouch, then it's really hard to absorb calcium, especially any type of calcium carbonate. It's almost impossible. So you might have to get this in an ion form and electrolyte powder that dissolves, but the point is that calcium needs an acid stomach to be absorbed, okay? Number two, iron deficiencies. Well, the same thing. The pH in the stomach should be acid to absorb some of the bigger minerals: iron, calcium, magnesium, potassium, things like that. So when you're deficient in iron, you get brittle nails. You also get what's called pica, which is craving ice or clay or ashes or some other something of the earth. You start liking to eat dirt. So that's an iron deficiency. Not everyone gets that, but that could happen. And then decrease zinc in the body or other trace minerals. So zinc is a trace mineral, and so are other minerals like selenium and iodine and manganese. And all these trace minerals are needed to build the enzyme structures to digest protein and have all sorts of chemical reactions in the body, but specifically to build body proteins. That's like a real important thing. So if we don't have enough zinc, you start getting acne, white spots on the nail, right there. Also hair loss. Now white spots on the nail are not necessarily only coming from gastric bypass. It could come when you ate a lot of sugar, which depleted your zinc. That's another cause. But the trace minerals are, you're just having a deficiency of trace minerals, so we have a lot of issues with that. And then vitamin B1, so you don't absorb B1 and you don't get the full B1. So your stress level might go up, you might have sleeping issues, memory issues, that's a B1 deficiency, and also vitamin B1 is necessary for neurological development, even the ocular muscles of the eye. So if you were to have someone, you probably see this, if someone looks this way and one eye goes this way, one eye goes this way, that's a vitamin B1 deficiency, okay? Like the eyes just are not in coordination. And then B12, that's anemia, that's chronic fatigue syndrome, that's neurological issues. It just goes on and on and on. And then protein in general. So you don't get the full absorption and digestion and assimilation of amino acids. So there goes the neurotransmitters, goes your mood, your hormones, and then your collagen of your skin, the ligaments, the tendons. I mean, here you are losing this weight, but how are you going to get the toned muscles or the skin that's sagging off your body? And then we have fat-soluble vitamins, because in order for the gallbladder to release, you need these other organs in place to all work in coordination. So without enough bile, you can't pull in vitamin A, D, E, K2, and that leads to a whole chain reactions of things with the vision problems, especially at night. The skin might dry out. Vitamin D is calcium, bone pain. Vitamin E is heart, hormones, and vitamin K2 is calcium extraction from the body and it drives it into the bone. So you might have a problem with some thinning of the bones and also calcification of joints in the arteries. Other than that, you'll be fine. And then we have folate, which is really an interesting vitamin that has a lot to do with an enzyme that helps in a lot of different functions, proteins and also blood sugars and digestion, and it affects neurotransmitters. And so you might get depressed just from having this one deficiency right here. So you're going to have to just be very aware of what's going on in your body and take some of these nutrients in forms that absorb easily. You might get dissolvable trace minerals and minerals, okay? And you might have to get certain B vitamins like in the nutritional yeast. I think that would be a good thing. The problem you're going to run into is trying to find something natural, because most people take synthetics, especially if it comes in a liquid, and they don't really realize the synthetics are very different than food-based or natural ones. So they might get the synthetic version, which doesn't really act the same as the natural food-based in the complexes. So I put a couple links down below of some ideas. If you have the situation, some good ideas that you can look at to start taking some real nutrition that you will be able to absorb to minimize the damage from that. But unfortunately, what they're recommending when you get gastric bypass is usually some shake that's filled with synthetics and chemicals and a bunch of other crap that you don't need. So you need a higher level of like a quality type thing. All right? All right, so I hope that helps, and thank you so much for watching. Press the subscribe button. Press it. Forget it, I'm done. Press the subscribe button and I will keep you updated on the future events.